kidney disease is something that, if you have it, you have to live and you need to enjoy your life. Some people think that, when you have chronic kidney disease and end-stage renal failure, which is when you're on dialysis, that your life effectively ends. It's quite a taboo subject in Gibraltar. My view and the charity's view is that you can have a good life with the disease. You just need to obviously, have the care and the support. Thankfully, we have it from the GHA on the medical side, but the care and support from your family, and the GHA have always been very good in helping the patients out to make sure that whatever they need to live well is there. From the charity's perspective, obviously, we want our patients to live well, so we advocate for them. We do what we can. We empower, the patients to live as well as they can. Sometimes it's very difficult depending on the patient's circumstances, but we need and we want the community to participate in helping people with kidney disease. So if you know someone, don't leave them. Be there, be that support. Whether it's in the workplace or whether it's at home or family friends, just be there and give them that care and support that they need.
You mentioned support, but how important is it to have personal knowledge and therefore self-empowerment?
Obviously, the last year has been very difficult because of COVID, and obviously the majority of our patients fall into the high-risk category, so they've been in lockdown, almost the better part of a year. So, for what we tell our patients, look, if you need something to better your quality of life, we're there for you.
You mentioned a lot of patients have been shielding over COVID because they are, of course, vulnerable. So what does the charity have to say about encouraging people to take the vaccine?
It's a conversation I had with Christina Cortez last World Kidney Day when, we spoke about COVID. I said, look, my personal opinion back then was the community needs to do everything to shield us, to make sure that we're here today. And from the vaccine perspective, the more people that get it, the safer we'll be as a community. It means that the 30-odd patients on dialysis, the transplant patients can go out for that meal that they want to and not worry about whether the person next to them on the table next to them is vaccinated or not. From our perspective, it would be the right thing to do to protect the community. And I think we've had such a good community spirit in the last year or so. I think it would only be right. I know people have their own views and opinions on the vaccine, but I would strongly encourage everyone that's thinking about having it to take the plunge. For people that aren't sure, to do that extra bit of research and satisfy themselves that it is a safe vaccine.
Gilbert Ligudi, MP, of course, not in government anymore. He's spoken about changes to legislation for an opt-out system on organ donation as opposed to an opt-in. What do you have to say about this? I know it's a subject that's quite close to your heart.
I was a beneficiary of the opt-out scheme that Spain had when I had my transplant. The UK have also, I think about 10 months ago, changed to an opt-out as well. In my opinion, it's the best way forward. We are obviously expanding the organ pool. I was probably the last kidney transplant recipient in 2008. We went over a decade without having anyone from a waiting list. We've had six kidney transplants alone in the last 2 years. So there is a need for organs in Gibraltar. It's not that there's one a decade, it's 6 in 2 years. So the opt-out scheme will obviously benefit us because we are also giving back. My personal opinion is it's the right thing to do. If the UK have legislated that way and we are matching the NHS organ scheme, why don't we follow suit? The proof is in the pudding. We will get more people out of dialysis and have a better quality of life. I've experienced it. 6 others have experienced it over the last 2 years.